Good morning, colleagues. My name is Cudjoe Bennet, and I'm a Senior Knowledge Management Advisor and Urban Health Lead for the Maternal Child Health and Nutrition Office in the Global Health Bureau of USAID. It's really a pleasure to be with you all today, although it's in a virtual capacity. It's also a tremendous occasion for us to be together on World Cities Day, where we can come together to collectively reflect on our role in advancing urban health for populations we care most about. I want to start off by giving a brief history and current status of urban health at USAID. As you may be aware, we have a global footprint of approximately 120 countries. Historically, we could say that USAID's work on urban issues have been focused largely in the Asian region, specifically in India and Bangladesh. But there are a number of our partner operating units and bureaus that focus on health. For example, global health colleagues that focus on climate work, democracy, and governance, and have some small budgets to support urban work. As we speak, there are a range of technical officers across the agency that are driving some of the changes in agency policy and spurring the agency to invest more in urban health. However, we are still very much in a learning position, and we're keen to collaborate with you and others. Thus, our presence, for example, even at this conference, and our growing interest in the area. We see some opportunity areas to advance urban health. For example, we think about cross-sectoral collaboration, integration, and synergies with primary healthcare, nutrition, water sanitation and hygiene, health system strengthening, private sector engagement, climate change, governance, and social accountability. We've heard time and time again, and we see as an opportunity area to strengthen both quantitative and qualitative data to better understand the context and describe intra-urban health gains and disparities. There are opportunities to close gaps in urban health policy, as well as promote learning approaches to help us implement and learn better and more effectively. For example, implementation research for embedded learning and action. So you're probably interested to know what we've been doing in urban health over the past several years. We've been operating at, I would say, 3 or 4 levels. Firstly, at the global level, one of our more notable activities as we speak is supporting the WHO's Private Sector Engagement Country Connector, which has engaged in some urban governance work of both the private and public sectors. Across the agency, we're in the process of finalizing an urban resilience framework, which aims to support USAID staff and implementing partners to build activities into health sector programming that strengthens urban resilience. We do have an internal facing expert urban working group, which is comprised of members from across the agency focusing on a range of urban issues, not just urban health, but many other spaces. And as a matter of fact, you may also be aware, and I'm sure there are a number of presentations and posters from our colleagues at the Building Healthy Cities project, which recently wrapped up from being supported from our colleagues in the Asian Bureau. That project was really focused on city policies, planning, and services with a health equity lens that improved data-driven decision-making for smart cities in particular. At the USAID mission level, we've been doing a lot of work to not only engage missions, but raise the awareness of urban health in particular. Last fall, we held a few sessions at our internal-facing Global Health Leadership meeting, where we, again, tried to drive home the urgency of addressing some of our urban health issues across lower and middle-income countries. Last year and also this year, we held and are hosting what we're calling our Africa Urbanization Workshops, where last year we focused broadly on urban issues to raise the profile and awareness in missions. And this year we're hoping to continue that work by focusing specifically on the impacts, consequences, and opportunities for urban health in selected missions. We also routinely engage specific missions on issues related to urban health, as you see listed here, just to give you a snapshot. We've worked with some external partners, for example, the DHS team, to analyze DHS data in a selected number of sub-Saharan African countries, to understand inter-urban disparities again when it comes to maternal and child health. And I want to spend a few minutes describing some of the work that maybe I've been closest to in terms of implementation research in sub-Saharan Africa, particularly in Kampala, Uganda, and Nairobi, Kenya. Firstly, the Mane project, which just wrapped up, was an implementation research project that really tried to harness the power of the public and private sector through a couple of innovative ways. First, the development of what we call Kampala Digital Emergency Transport System, which in a very short period of time, just 2 years, was able to transport over 4,900 cases to facilities to enhance referral capacity. We also engaged in a private facility accreditation model, which doubled antenatal care attendance and increased facility-based deliveries by about 32%, and established a mother savings account for antenatal care delivery and P&C. We also worked with private providers to negotiate price reductions and transparency, particularly for the populations they served in urban informal settlements. In Nairobi, Kenya, the Kuberous Matani project, which will wrap up early next year, uses digital tools to empower individual women. To date, we have supported a portion of approximately 300,000 women enrolling in their SMS two-way communication platform known as Prompts. We also engage and provide feedback to not only residents and health workers, but Nairobi City County administrators on maternal newborn health conditions. And we provide and support in-facility clinical mentorship to improve life-saving obstetric and newborn care skills with health workers. As part of these efforts, we also had a time-limited urban health community of practice that wrapped up just earlier this year, 2022. It was really created to support the two IR projects I just described in Kampala and in Nairobi. Eventually, we expanded the group to engage global stakeholders with an interest in urban MCHN or MNCH, particularly in sub-Saharan Africa. The objectives of that community of practice are really to support our grantees, as I mentioned, but also to provide a place for global discussion about urban MNCH and promote the implementation research approach. By the time this community of practice wrapped up, there were approximately 380 members from over 50 countries. And although we got a lot of positive feedback on our community of practice, one thing of note is, the USAID mission in Tanzania, for example, really emphasize how engaging in this community of practice enable them to include urban issues in their upcoming country development and cooperation strategy, which is quite important for the country of Tanzania. So to wrap up, we might think about collectively some opportunities to further advance urban health. So maybe some thought questions for us as we go through the day today. What are some of the things that we are all learning about intersectoral collaboration to advance urban health? Who are the key global and country leaders and stakeholders that we should actively engage, and how and when should we do that? How are we engaging in existing urban and urban health communities of practice? So for example, and we might want to link to some of those networks. So for example, even the ARISE consortium, which is here with us today. We know there's an active community of practice that's being supported by the International Society of Urban Health, the Urban Immunization Working Group, which we heard about from our UNICEF colleagues and others. We might also think about what opportunities and gaps we might address as part of this institution, Health Systems Global. If we decide to move forward with a community of practice, what is an appropriate structure for such an entity? Who should be engaged? And is there any interest in starting an informal working group within Health Systems Global? What might be a key focus of our areas of community of practice? So just some thoughts to get us going today. I want to thank you very much for your time. Really looking forward to an exciting session today, and excited to be here. Thanks again.